Assalamu alaikum. Today we are going to discuss about a neurological condition which is known as the cerebral palsy. So our lecture consists of two parts. In the first part we are going to discuss about the introduction, risk factor, types and about the clinical presentation of the CP. And in the second part we discuss about how we are going to evaluate or assess the condition and its management. So first we are going to describe what is CP. Cerebral palsy is basically a non-progressive damage to the brain during the infant life or during the first year of the infant life or during the fetus. If in this time period damage to the brain occur, it is known as the CP, and the CP causes the disturbance in the movement and the posture of the patient. The second one is the criteria for the diagnosis of CP. Basically, there are three criteria on the basis of which we are going to describe a condition or we are going to diagnose the disease. The first one is a neuromotor control deficit. Basically, it is going to describe as a condition brain damage that causes the neurological and the motor deficit in the body, and because of this the patient is not able to perform its movement, and there is a deviation in the posture, for example lordosis, kyphosis, etc., can develop in the patient. The second criteria is the static brain lesion, means it is non-progressive. If certain part of the brain is damaged, then it remains to that part of the brain, does not progress to any other part of the brain, so it is a static brain lesion. And the third criteria is basically a time period, means if the brain injury occurred during the infant life of first year of the infant life or during the fetal life, then it can considered as the CP. But if the brain damage occur after that time period, it is not described as the cerebral palsy. The next one is the risk factor. Basically, what are the risk factor or the causes that can lead to the development of the CP? The first is the prenatal risk factors, means the factors during the pregnancy. If the woman is suffering, if the pregnant lady is suffering from rubella infection, it can lead to the damage to the part of the, it can lead to the brain damage in the fetus. But it can be controlled if the woman is taking the proper vaccination. The second factor is any factor that can causes the compression of the middle meningeal artery or the carotid artery of the fetus, so the blood is not supplied to the fetal brain and it can causes the brain damage. The second part is the perinatal complication. Perinatal complication means if the baby is in the breech position or forceps delivery method is used, or if the first cry of the baby is delayed, it can develops the CP. How we can going to describe the delayed first cry? Because after the cry the lungs are properly expand and the breathing process start. If first cry is delayed, the lungs are not properly the lungs cannot expand properly, and the blood is not supplied to the part of the brain, and it can causes the brain damage. The next is the postnatal complication. Postnatal complication, if the after during the first year of the infant life, if the infant is suffering from jaundice or meningitis, it can lead to the cerebral palsy. The next comes the types of the CP. The types of the CP, basically there are four basic types of the CP. The first is the spastic CP, ethetoid CP, ataxic CP, and mixed CP. In these types, the spastic CP is the most prevalent type of the CP. Basically, in spastic CP, the muscles which are prone to the tightness become hypertonic. For example, gastrocnemius soleus complex, hamstring muscle, or adductors of hip joint muscles, they become spastic or hypertonic. In the second type, ethetoid CP, in ethetoid CP, basically there is the involuntary movements in the body. For example, if the patient is sitting in its normal sitting, relaxed position, then there is an involuntary movement of the face or the hands which are not able to control by the patient. The next is the ataxic CP. Ataxic CP means the patient is not able to coordinate its movement and maintain its sitting or the standing balance. The next is a mixed form of the CP. Mixed form of the CP means although either all the three types occur in one patient, but most commonly the symptoms of the spastic and ataxic CP occur in this mixed type of the CP. The next is a clinical presentation on the cerebral palsy patient. How the patient is going to represent. First, patient is either become hemiplegic, diplegic, monoplegic, or quadriplegic. Hemiplegic means whole of the one side of the body is affected. The right side or the left side. Diplegic means either both the lower extremity or both the upper extremity is affected. Monoplegic is only one limb is affected, and quadriplegic means both the upper extremity and the lower extremity of the patient is affected. And the second one is the impaired movement. Impaired movement means the person is not able to do the proper movement, for example holding a spoon, picking up the objects, because the spasticity develop in that muscle. The next one is the incoordination of the movement. It is basically most common in the ataxic type of the CP. And the next factor is the flaccidity. Flaccidity is basically and during the first month of the neonatal life, during the first month of the infant life, basically there are flaccidity in the muscles, because spasticity develops gradually when the muscles are not going to work. So first clinical presentation is the flaccidity, and then spasticity is going to develop. The second one is the speech deficit. If the larynx muscles are if the laryngeal muscles are affected, then it can cause the speech deficit, and in this condition there is also the problem in swelling and chewing of the patient. And the most common clinical presentation is epilepsy. The patient suffering from cerebral palsy also complain the epileptic seizures एंड मेंटल रिटार्डेशन हो जाएगी. उसके अलावा जो है वो मस्कुलर डिसऑर्डर होंगे. मस्कुलर डिसऑर्डर फॉर एग्जांपल द स्कोलियोसिस डेवलप. इफ वी आर कंसीडर द पोस्चरल मस्कुलर डिसऑर्डर्स, then scoliosis, kyphosis and lordosis can develop due to the spastic muscle. Also in the feet, equinovarus condition develop, in which there is a plantar inversion and the supination of the foot. Flexor hip contractures can develop, and it can cause the femoral anteversion.